So Nate came in with a diagnosis of elbow pain along the inside, which is a very common diagnosis with baseball players, particularly your overhead athletes, because you have a growth plate in there, and that flexor mass, where all those muscles come up and insert on, can apply a lot of stress through that growth plate.
The throwing athlete it's not uncommon at all to have issues with the shoulder or the elbow. Common injuries in the shoulder of an athlete would include, particularly in pitchers, would include an injury to the biceps, which is in the front of the shoulder, or the labrum that surrounds the socket. Common injuries or locations of injury in the elbow include the inside of the elbow or the medial epicondyle, which is right here, and that's from the torque that a pitcher or an overhead thrower would put on that part of the elbow way back in late cocking phase of throwing. Another common issue is in the back of the elbow. At the tip of the elbow, we call that bone the olecranon, and that's often painful or can cause pain with overuse or poor technique at the end or at release of the ball. And I felt like there were some technical things common in young athletes that are developing their body, having the strength, again, to be able to push off the mound or throw with velocity. Well, as you can see, we've got a nice outside setup with the mound, so it gets the athlete back in their normal dimension. Baseball is played outdoors, so we're fortunate up here. We got enough space at ORA where we can have a full mound outside, so that's a feature we really enjoy. And then the other thing that allows us to do is replicate the game time situation and not just simulate, but actually replicate what they're going to be doing off the mound.
It's easy for a patient to try and throw on flat ground, but if we're specifically working with a pitcher, sometimes it's better to get them in that throwing atmosphere to where they can really get the feel of that rubber, to where they can push off and we can get a better idea of how their mechanics are going. So the throwing motion, or pitching motion in general, is such a high velocity, complex motion that places high demands about the arm, whether the elbow or the shoulder, and without the proper conditioning or mechanics, it can predispose an athlete like Nate to injury. The body is one big connected chain, to where patients a lot of times aren't using their legs, aren't using the core. And the more you can use your legs and your core, kind of those larger powerhouse muscles, the more your shoulder and elbow will thank you towards the end.
Fortunately, we have some therapists here that have particular expertise in treating throwing athletes that improved his situation quite a bit. I think we've had real good success with it. I've been able to see quite a few athletes in season get back to throwing without pain, without issue, because of what we're doing here, breaking down their technique and improving it.